So I was noticing this heaviness in like, like your underwear line, like at the base of your vagina. Like it's just heavy. I feel like I'm always bearing down. And it obviously wasn't like that before children. I tried to. And also I was noticing if I had to pee, it was either I don't have to pee or it's an absolute emergency and we need to go now. So going anywhere was like, you needed to know where the bathroom was. Planning out my day. I think I may have peed my pants once in the Target parking lot. I mean, it was really bad. What else was there? When I would use the bathroom, after I would use the bathroom and I would need to wipe, I could feel the toilet paper wiping the inside of me. So the actual vaginal wall was coming out. And I was told by two OBGYNs that it's just part of life. I think they actually called it like the battle scars of having children. And I really didn't want to accept that as my fate. And you told me about the Perky Peach. You told me it's going to help with incontinence and it'll help with gaining some strength back into the walls. But you didn't say anything about the prolapses, but it actually did indeed help my prolapse, which was like the best thing about the procedure was like I just didn't feel like the inside of me was falling out of me. Yeah, and I recommend it to all the moms I meet. I recommend it because nobody knows about it. Unless you are just scouring the web and you accidentally stumble upon it. I don't think you're going to find out about it because doctors certainly aren't going to tell you. My OBGYNs were like, go to a medical spa and ask for it. They told me you can get a mesh lining if you are really that upset about it, which obviously nobody wants. Like that is like the worst case scenario that you have to get a mesh put into you. So I love it. And it doesn't hurt. Yeah. It wasn't like the laser hair removal. So like I really like look forward to getting the treatment. It's so easy. You just come in, it doesn't hurt, and your skin looks better like immediately. Yeah. The tissue itself is softer. Not only can you see that the labia has like shrunk, but like it's softer, it's more supple. So the inside of you is also looking and feeling much, much better. Yeah. I would tell her to look into it because, the only other options, you go to physical therapy and they say, here's your pelvic floor exercises. And just so you know, you're not going to be able to notice anything within a minimum of 6 months. And also just so you know, you might not notice anything at all. So good luck. So it's really hard to keep up with doing these exercises because they're boring. They're really boring. And you don't know if it's going to work. So I would do this. And then on top of that, you can start doing your pelvic floor exercises because I noticed another great thing, I was able to have the mind muscle connection where I had lost that very much to where I would try and pull my pelvic floor up and I just couldn't. I couldn't feel it. Like I felt like maybe one side I was getting and then the other was just this dead zone. And with this service, I was able to, I don't know,
that sensation.
Better. Yeah, reactivate it or find it. Yeah. So I can actually do a proper pelvic floor exercise. Yeah. Immediately. So the strength, it took maybe 2 services, but the pressure I felt, that was, I want to say within the first service, I noticed I was using the bathroom and I noticed I was structurally sound again. The inside of me was staying inside of me. Yeah. And I was really excited because you didn't promise anything like that. I was just hoping it would work, and it did.
I'm Dr. Knies. I'm a board certified physician. I'm an MD and founder of Rose Injectables. The reason for my love and to start this practice was because I was a woman who was struggling with different issues from aging and I wanted help, and I was having a harder time finding it myself as a physician. And I adore my colleagues, OBGYNs, but when I've gone for my rechecks, there weren't any questions about leakage, incontinence, libido, dryness, anything like that. And I knew that I needed more help and I wanted to just age a little bit more gracefully. So Perky Peach that you just heard about, I just want to explain to you what the treatment is. So Form of E is a wand here that we use on an Empower device. And this is bipolar radio frequency that can remodel the tissue of the pelvic floor and actually create a little bit of hypertrophy of the muscle tissues so that you can get support of those pelvic floor structures to help eliminate incontinence and stuff. So the biggest thing we hear is leaking with sneezing or coughing, things like that. So this is the device that's used. It's bipolar radio frequency here. It's testing the temperature 1,000 times per second. So it's extremely safe. There's no pain. There's no downtime. The internal portion of the exam is 10 minutes and the external is 10 minutes. And the external feels like a hot stone massage. That's the specifics to it. So it's very people are trying to understand what to expect, and the process and the treatment is so amazing, and what we're able to do for patients. And so many notice almost immediate results, or within a couple weeks, that they can actually just live very different in their life. So our second location is now open in Colorado Springs as well. We're at 1330 West Colorado Avenue, and cross street is 14th. We have our same office in Canyon City, so we're not going anywhere. I love taking care of my community. I'm a Colorado native, grew up in Wetmore in Colorado Springs, and have just enjoyed being able to bring advancements in women's healthcare to my patients, and keeping their safety in mind, and making sure that you guys get phenomenal treatments that you may not even know are available.